The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the first surgical clinic of the General University Hospital. Blood collection, individual collection systems. Regardless of the sampling system used, we will prepare the following equipment. Non-sterile gloves, emitting dish, skin disinfectant, gauze pads, a tourniquet or constricting device, and sampling tubes with adhesive identification labels, which we will stick parallel to the tube so that we can see into it and make scanning the code in the laboratory easier. Sampling system. Containers for infectious and sharp waste. Request forms for sampling. And transport bags for biological material. After performing hand hygiene, we confirm the patient's identity by asking for their name and checking the identification label. The patient is then positioned comfortably and safely, either seated or lying down. We verify that the information on the requisition form matches the labels on the tubes. The puncture site is disinfected by wiping or spiraling, and once disinfected, it must not be touched again, even with gloved hands, to avoid the need for re-disinfection. For vacuum collection using the P-stem vacutainer system, it is ideal to draw blood from an uncompressed arm. However, if the veins are not visible or palpable, a tourniquet is applied approximately 8 to 10 centimeters above the selected puncture site for a maximum of 1 minute. The vein is stabilized by pressing below the puncture site while slightly stretching the skin, which helps reduce pain. The needle is inserted into the vein with a quick motion at an angle of approximately 30 degrees. The vacutainer flashback needle allows for visual confirmation of successful venipuncture, increasing the chances of a successful draw. The tubes are inserted in a way that allows visibility of the filling process to monitor the amount of incoming blood. After filling the first tube, the tourniquet is released, and the remaining tubes are filled sequentially, ensuring each is filled to the prescribed volume and mixed by gentle inversion without shaking. Once all tubes are filled, a dry gauze or cotton pad is placed over the needle, which is then removed and disposed of in a sharps container. The puncture site is compressed, and the patient should avoid bending their arm at the elbow, as this increases the risk of hematoma formation. The workspace is cleaned up, and the collected tubes are checked once again against the requisition form before being sent to the laboratory. Blood collection with a butterfly needle. A plastic lure adapter with a blue cap is attached to the tubing. The bevel of the needle in all collection systems must always face upwards. The collection set is held by grasping the butterfly wings, pressing them together between the thumb and index finger. The needle cover is removed and venipuncture is performed. Proper placement of the short needle in the vein is indicated by the presence of blood at the start of the extension tubing. The required blood draw is completed, the tube is removed, a dressing is placed over the puncture site, and the needle is extracted while applying compression. If the needle has a safety cover, it should be engaged. For vacuum collection using the SAS TDT monovet system, the venous vacuum collection set consists of a needle with a retention mechanism where the sharp metal portion of the needle is embedded in a plastic cone. Compression is applied to the puncture site, with circumferential retention hooks for securing the projections of the collection syringe and protecting the opposite end of the needle. After disinfecting the puncture site, venipuncture is performed and the required amount of blood is drawn by retracting the plunger. Filling the tube is also possible by creating a vacuum in advance by bending the plunger before attaching it to the collection needle. The collection needle is attached to the syringe so that the inner needle perforates the membrane within the syringe. It is secured by rotating it so that the hooks of the plastic cone engage with the projections on the tube cap. If necessary, the tube is changed, ensuring the needle is held steady without touching the puncture site. After completing the final blood draw, we remove the collection tube. The needle is withdrawn by pulling the plastic end, and once fully extracted, we apply compression to the puncture site.